Next, let's introduce the prescription for the menu. Some operations inside. After entering the interface, click on this graph. The text of this menu will appear. We go through these two arrows. Functions can be switched. First, look at the following section. It is divided into 4 in total: acute, body part, chronic and multimodal. Then the following words. That's the name of the prescription for this function. You can choose with the up and down arrows. Same operation in the other 3. Here we will first discuss the difference between acute and chronic. Acute means that some symptoms come faster and more violently. It occurs in less than months. It's an acute condition. So chronic means over and over again. Then delay for a long time. It doesn't get better for months or even years. More than 3 months old. These are chronic conditions. Therefore, when customers choose acute and chronic, you can first find out which kind of disease it belongs to. Then choose again. Determine what type of disease this condition belongs to. We will then select the corresponding prescription for its disease condition. Clients before using acute and chronic. You need to know what's wrong with it, such as shoulder pain. Is it frozen shoulder or some other type of disease? Clients need to know in advance. For the names of some diseases that the customer is not aware of. But when he wants to use this magnetic ring for physiotherapy, then he can choose the body. This is treated by zoning. Clients can directly use this function of the body for clinical treatment. In the prescription for this body, just muscle training and some postpartum repair, and the treatment of pain manipulations by region. Here we click the back button. You can see the schematic diagram of this treatment. For example, what I just presented is only about the back waist and the elbow and all the other manipulations. This diagram will indicate the area where we operate. Like this tennis elbow. It's a complication of the elbow. It will appear red at this position. It means that we treat the area. Switching to other parts also has corresponding ones. For example, this is used for muscle building and weight loss. It can also be applied to pain physiotherapy in the thighs. That's what our body uses this interface for. On this interface function of acute, this treatment diagram is divided by disease. And this is a diagram of where pain points are located. Red dots like this just indicate some pain points in the shoulder to treat. We can press and refer to this pinpoint. Go get the handle and treat this area. The two arrows toggle between prescriptions. Then it will be presented in the prescription. And here's the treatment diagram for this. Click on the diagram. You can directly check the name of the prescription. And here it is. It is about the treatment of head pain. I'm showing you treatment of the head. The head is divided like this: F4, F3. F3 is an area we currently use a lot. No, chronic is the same as acute. Except the onset time of the disease is different. Their treatment prescriptions. For example, the name and its purpose. Like pain manipulation. And this treatment of the head is also chronic. Head therapy refers to this TMS, transcranial stimulation. Some pain relief for the head. And then there are treatments for depression, for example. You can use this as a treatment. About this schematic, we mainly just look at some color marks on it to understand where it operates. That's what this schematic is for. Let's talk about polymorphism. Multi-style operation is like prescriptions that aren't in all acute and chronic conditions. And after some advice from the doctor, when this machine can be used for treatment, and we can do a clinical trial of using this multimodal prescription. The second is that some customers often change their prescriptions. And customers need custom prescriptions. You can customize it in this multi-style.